Yeah, thanks, Kathy. Before I get going, I should apologise because I'm absolutely full of cold today. So if I sound like I'm all bunged up, I am, and if I'm rambling and making no sense, I can only apologise. But with that said, welcome everybody. I'm really excited to be here. I think this has been a really exciting collaboration between the West Yorkshire ICS and the AHSN, the first of many, I hope. And I'm really excited to hear about the projects that have benefited from it this afternoon. So but as we get going, I'm going to move on to some housekeeping. Thanks, Victoria. So as you might all have just had a pop-up, we're recording the meeting today. If anybody's unhappy about that, then please let us know. Bear it in mind if you're making comments. Please mute yourself if you're not speaking. You all know this. This is good video conferencing etiquette, and I'm sure that you're all experts on this. Please feel free to turn off your camera. But if you're talking, we'd be really grateful if you could turn your camera on so that we can see you. It's really nice to be able to put a face to the name. Q&A, please feel free to use the chat function throughout. But there is time right at the end for Q&A. So if you know, whatever floats your boat, we're happy to take Q&A any which way. Okay. So the agenda, as you can see, is as laid out. There's going to be some introduction from myself and from Kathy, and then Vicky, I think, is going to explain how the program's worked, and then we're going to hear the really interesting bit. We're going to hear from PKB and Dignio, and then, as I said, lots of time for questions. And thank you, Ori. If people would like to introduce themselves in the chat, you'd be very welcome to do that. It's always nice to know who's here. So thanks for nudging me on that, Ori. Okay. Without further ado, so I was asked to give some thoughts and insights into the links between innovation and climate change. And as I said, I hope my voice is going to hold out. I'm going to keep it fairly brief. But my name's Frank Swinton. I'm the climate change lead at West Yorkshire and Harrogate ICS. I do that for 2 days a week, and the rest of my time I'm a consultant anaesthetist at Airedale Hospital. So every week I get some time at the coalface, as it were, reminding myself exactly what it is that the ICS and the AHSN are here to support and help deliver. And I think that the world has changed significantly in the last 2 or 3 years, and again in the last 2 or 3 months with COP26, 2 or 3 weeks with COP26. And I think that it's abundantly clear now that not only that climate change is caused in part by healthcare, the health and social care that we deliver is causing climate change, is contributing to climate change, but also it's abundantly clear that health and social care are going to be some of the industries which are worst hit by the effects of climate change through things like migration, poor air quality, increasing deprivation and inequalities in society, as well as the more sort of physical things like wildfires and floods, etc., etc. So I think that it is absolutely fundamental to health and social care that we get a grip on climate change and that we play our part in both mitigation and adaptation. So with that said, I think that there are really two really big ways in which innovation can help with this effort. And one is the sort of traditional obvious innovation, new things that nobody's done before that are going to contribute significantly to help us reduce our carbon footprint and our environmental impact and or increased biodiversity, for instance. And we know that historically, those really new innovations, those brand new technologies have taken decades to get to the market and to become really rolled out throughout health and social care. We're not good at adopting new technologies. So I think that the AHSN has a real tangible role to play there. I think that there's a big opportunity for the AHSN to help us adopt technologies and methodologies that are already out there. They're just not used in this particular way within health and social care. And so that stuff often lands with a bit less of a big bang. It's a bit of a sort of softer rollout, but is also sometimes really difficult to get embedded at the ward or hospital or primary care practice sort of level, really where the work happens, if you like, where the care, health and care is delivered. So I think that with that in mind, I think the AHSN again has a really big role to play to help bring these companies to the site of local health and social care providers, help them understand the landscape, which is complex and ever changing, help them understand the way that the funding works. I think there's a huge amount of work that the AHSN can do to help these small innovative companies come to market much more quickly. Now I'm coming to the punchline now, which is that increasingly every single innovation in health and social care needs to consider their environmental impact and their social impact. Because if we're going to move to net zero by 2040, which is essentially a legal mandate in the NHS at the moment, arguably, everything that we do has to have an environmental dimension to its thinking. And just to be really clear about that, the numbers are a bit muddled, but by 2045, the NHS will not be dealing with companies that are not net zero, and not only in their immediate dealings, but everything upstream. So everything from mining the raw materials to putting the plaster on the patient's leg is going to be net carbon zero. So I think my challenge, I think, for colleagues at the AHSN, Vicky and Kathy, is that next year, I think we need to incorporate a bit of net zero into the wider Propel family, and make sure that this becomes absolutely woven through everything that everybody's doing. So thank you very much for having me. I'm really excited to hear from Dignio and PKB, but I'm going to hand over to Kathy, and looking forward to the rest of the afternoon.
Oh, sorry about that. The mute button disappeared in the way that it so often does when it's important that it's there. So thank you, Frank. I hope you feel better throughout the course of this. You do sound a bit rough. So I'm Kathy Scott. I'm Deputy Chief Exec from Yorkshire and Humber Academic Health Science Network, and I just wanted to run through what the Yorkshire and Humber AHSN is doing in this space, and also the AHSN network. Could I have the next slide, please, Vicky? Thank you. So there are 15 AHSNs in England, and we have a clear focus on driving the spread and adoption of health innovation, increasing economic growth and improving outcomes for patients. And increasingly, we prefer to think of this as supporting sustainable healthcare rather than the three individual parts. So while individual AHSNs operate on a local and regional level, fundamentally we operate as one large national interconnected network of networks, and we work together to spread insights, learnings and innovations. So as an organisation, all AHSNs are about the spread and adoption of innovation. We share our learning around what works and where the needs are, and that means that we're able to quickly identify potential solutions. And for me, innovation is just doing stuff differently, and we need to do things differently if we're going to meet our net zero targets. So this, fundamentally for me, this should be the AHSN's bread and butter. It's about what we do on a day-to-day basis. And what we do on a day-to-day basis is successful. So in 2021, our spread and adoption projects benefited over 300,000 patients. We leveraged £462 million of investment into our local areas, and we created 700 jobs. So in a minute, I'm just going to talk through some examples of how our work to spread innovation is helping and can help to reduce the harm that health systems do to the environment. Next slide, Vicky. Thank you. So the Greener NHS team also recognise that innovation is important, something I'm massively relieved to hear, because as I said, if we do the same stuff, we'll just get the same results. So we need to do things differently, and that is innovation. And in the 2020 Net Zero report, they name checked us, so working with the academic health science networks to embed net zero into our business as usual processes. And what that means is that we have a focus on, firstly, identifying those innovations that will make a difference to this agenda, either specifically or tangentially, and then looking at the innovations that we have in our stable, if you like, at the moment, and working with them to work through what impact does their innovation currently have on the environment, and how can they make it less of a harmful impact. So next slide, please, Vicky. So because we make things happen, we like to think that the HSN network, we change how healthcare is delivered. And we're supporting our NHS colleagues to change how they work, and as a side benefit, this also benefits the environment. So this is the tangential stuff that I talked about a minute ago. So as an example, we worked with Trust in England to roll out evidence-based placental growth factor diagnostic tests. These have landed really well in Yorkshire and Humber, so you might already be aware of them, but they rule out preeclampsia in pregnant women, and it means that only those with the condition need to stay in hospital, and that reduces the number of bed days needed, and so reduces other associated consumables, and all of that impacts on carbon emissions. And we did some work with the Centre for Sustainable Healthcare, and we estimate that we saved over 1,000 tonnes of CO2 by implementing this in England. We've also been supporting the rollout of virtual wards and virtual monitoring devices. So these innovations mean that people can be monitored from the comfort of their own homes. They use special kits that can take readings. It can look in your eyes, your ears, and so on. And it sends the results back to the clinician for review and appropriate treatment. And that reduces the need for face-to-face meetings and travel requirements. The whole agenda of digital outpatient appointments, remote monitoring and so on, supports the environmental agenda by reducing travel. But obviously we need to take into account any environmental harm from digital technology. So we don't count the impact of all of our work yet, but that is one of the ways that we're looking to embed it as business as usual. And then we also support innovations that reduce the amount of healthcare that people consume. So Health Navigator is being trialled in Humber and North Yorkshire, and that identifies people with complex multimorbidities who are at risk of being high users of healthcare. And then it provides individual health coaching that enables patients to manage their own conditions better. And then it reduces trips to the GP, to hospitals and other clinical settings, as well as reducing medication consumed. Next slide, please, Vicky. Thank you. So this is a way that we are supporting innovation from idea to uptake. So the previous examples supported environmental sustainability almost as a side benefit. And because we support innovation from idea to uptake, we can identify early thinking that would have a direct impact. So the multicath research trial is looking at whether you can clean and reuse plastic catheters in a way that is safe and acceptable to patients. Being able to reuse plastic PVC catheters would reduce waste, so over 100 million catheters are thrown away each year in the UK. In addition, as a network, we're supporting work around the development of reusable PPE alongside Department of Health and Social Care and NHS England colleagues. And through our accelerators and support for programmes like SBRI, we're Small Business Research Initiative, we're working to identify potential innovations that will impact and support them to become market ready so they can be spread across England. And finally, we're working with industry and innovator partners to develop and test new tools and pathways that will, for example, reduce emissions from asthma inhalers. And I'm going to talk about that one again in a minute. Next slide, please, Vicky. Thank you. So all of this work is supported by the fact that we're increasingly becoming influencers in healthcare innovation. I have yet to be offered any free goods that I can put on my Instagram page, but nonetheless, we do see ourselves as influencers, and we're using this position to support the environmental agenda. So we support our local systems and organisations in delivering their commitments. we're creating markets and communicating priorities to industry. So this green accelerator, for example, signals the importance of this work, and it stimulates the development of innovation with an environmentally sustainable impact. And honestly, the bigger and further we go with something like Propel Net Zero, the more of a message it sends to industry and the more stuff we get coming through. We support innovators to understand the impact of their innovations, so working with them to explore how they can calculate and reduce the harm done to the environment. And we're giving innovators the tools to deliver environmentally sustainable innovation in the future, so helping them to understand the requirements of new policies, for example, around the supply chain. And the final thing here is we're increasingly providing what we're calling an authoritative voice on environmentally sustainable healthcare innovation. So we're bringing people from the NHS, local authorities, voluntary community sector and wider to learn from each other during our learning and sharing events, our blogs, articles and speaking slots. So the learning and sharing events are one a quarter. The last one was on anaesthetic gases. The first one was on how you develop your journey as a trust towards being an exemplar in the environmental sustainability space. And I have to say, and I've said this so many times, so you just need to roll your eyes if you've heard it before, the thing that really made a difference or really was really encouraging in both of the events that were run so far was the amount of chat in the sidebar and the generosity that people were sharing their experiences, their tools, their understanding. I've not seen that happen before. And it was really encouraging as well that that both of them, we've had not just people from England, not just from the NHS, but really widely from as far away as Australia. So that was great too. Next slide, please, Vicky. So this is some of the stuff that we're doing locally. So working with our ICSs and our regional NHS England and improvement leads to support regional ambitions. So you know about Propel Net Zero, because if you didn't, you wouldn't be here today. Healthy IO is one of the innovations that's where the sustainability is a tangential benefit of the innovation itself. So this is a remote monitoring, a remote diagnostic for urine testing. And you get a little pot to pee in at home, and you get the app that talks you through doing the test, and it gives you a reading that is at least as accurate as your GP practice. So by supporting the rollout, we've increased the number of patients with kidney disease due to, or potential kidney disease due to diabetes. We've increased the number of patients tested at home and therefore less travel, caught people who have problematic levels of ACR sooner, which prevents hospitalisations and patient deterioration of their conditions. And this prevention mechanism also has a large impact on environmental sustainability. I mentioned about asthma inhalers earlier, so we're working with industry, looking at how GPs can identify high users of asthma inhalers and identify them, work with them to change the way they use their medication, reduce the number of asthma attacks that they have, and where appropriate, change their asthma inhalers for ones that are more environmentally friendly. We've been developing a green calculator, so we'll very happily share that with you if you would like, that looks at a number of different factors. It's not just about carbon impact, and that has helped us to work with SMEs in assessing their own carbon impact. And finally, we're working with a company called Pinpoint, which is using AI to take the information from a single blood test and rule out people who need rule out people on the waiting list for cancer. So it keeps in only those people who are most need of an appointment for to diagnose their cancer. I've expressed that really badly. Basically, it wipes about 20% off the waiting list. So it stops people from having to go to hospital, and stopping people from having to attend is not only great for NHS workforce and so on, it's also good for environmental sustainability. Next slide, please, Vicky. So in summary, the AHSNs, including Yorkshire and Humber AHSN, we can contribute to the net zero agenda in 4 ways. So through identifying the technology, services or products that will specifically reduce harm done to the environment as their primary focus. Through transforming pathways with a side benefit of reducing emissions. By supporting our supply chain to be greener. And by improving understanding and changing the culture of staff, patients and their families, so that they can also select the behaviours and the products that cause least harm to the environment. So that was it from me. Thank you very much for listening as I whittled on. I'm going to hand you over to Vicky now to talk a bit more about Propel Net Zero. Thank you, Vicky.
Thanks, Kathy. Just going to throw up some more slides. So for those that don't know me, I'm Vicky Baines. I'm a program manager at the Yorkshire HSN, and the Propel Net Zero program is sat in my portfolio for this year, and I've been very kindly helped by several other members of the HSN team, including Pete Waddingham, who's also on this call. So thanks, Pete. So as a bit of a background about the program, we've spoken with the West Yorkshire climate change team when it was at the beginning of this year, so January, about how we could really work together about and support innovators with green ideas and how we help them spread and adopt those innovations. Following that, we have run this pilot Accelerator program over the summer, so just a 3-month program, so very, very short, short and sweet, I would like to say. Just helping them think about how we can articulate green innovations, how we can talk about it properly, how we can get the NHS to engage and think about, what are those drivers towards adoption. So we've helped them understand NHS priorities around the net zero. We've helped them with bid writing for things such as the SBRI funding that Kathy mentioned. We've spoken to them about carbon calculators and also how we articulate and do that comms and engagement piece around not just their patient benefits and their NHS benefits, but also about the additional tangential carbon impacts that they might have as well. So we had applications running in May, and we had about 8 companies who applied. Through that, we kind of did a very quick shortlisting based on their application forms, and then we had some informal interviews with the shortlisted innovators, just to make sure that we understood what they were trying to do, what their ambitions were, what their products were, so that we could understand that they make sure that they reflected what we were trying to achieve as part of Propel Net Zero. So we, because this was a pilot program, we wanted to make sure that we were getting an impact, and that, that not just us as an HSN we're seeing a benefit, but also that mainly that those innovators that were involved were able to see a benefit of being part of the Accelerator, to understand which of the mentoring and masterclasses that we put on during these 3 months they found most beneficial, so that we could look towards developing this next year as a possibly larger program, as Frank kind of mentioned and challenged us to earlier. How do we embed this maybe possibly into the main Propel program? How do we support our innovators better? What are those factors that actually made this work? So overall, our innovators really liked being a part of this program. It helped them understand that landscape within the NHS, and they felt like the range of topics we covered were valuable. I think they would have liked some of the programs to be for the program to be a bit longer and have a bit more time to do some of that one-on-one mentoring and sitting down and really working through the problems with them, which is something we can definitely address when we're thinking about planning for next year, making sure that we include lots of time for that mentoring and to really help them develop their products and their offers a bit better. So our 3 innovators who were on the programme were PKB, Indignio, and then finally Automedi. So as you hopefully will have already noticed, Automedi aren't here with us today, and that is because because through being part of this programme, they've really understood what the NHS is all about, how it works, and where they are on their net zero journey. And unfortunately, Automedi are a bit further ahead than where the NHS is, and though they really can see where a benefit of being involved with the NHS, there are a lot of other kind of sectors who are asking for their attention. So they have thanked the HSNs for being part of this programme, because it's really helped them understand healthcare and healthcare innovation and healthcare net zero in more ways than they had originally. But unfortunately for us, they aren't continuing on the programme. So that was it for me. I think we've got a little bit of time for questions. If anybody has any questions about the HSN network, the HSN, Yorkshire and Humber HSN's plans and Propel Net Zero, if anybody has any questions. No.
So Vicky, you've just got comments in the chat talking about the sort of some of the positive feedback that we've received. And yes, thank you all for that. And I do think that, Vicky, you're absolutely right in that for Automedi, this was a really positive journey. It helped. We saved them from investing time and money that they would not have got back. And we also saved the NHS time and money in terms of exploring some of the possibilities around it, only to find that they weren't at the right stage.
Definitely. I guess without further ado, I think it's probably worth us moving on to our kind of main speakers for the event. So I'll pass on to Tom, Patients Know Best, who's going to present and provide a bit more information about them and their product.
So I'm going to do the risky thing of trying to run a quick quiz before starting a presentation. So I'm going to apologise in advance, because despite working for a technology company, this is definitely going to go wrong. So I've just put the link to Slido in, and the number is 315025, but you'll be able to see that as I share my screen. So can everyone see my screen, and is everyone, I wish there was a prize, Kathy, especially when you talked about influencers and the lack of merch. I was thinking I'm going to let the side down and do a quiz without any merch or any fun bits. So just as I say, when people are, I'll give people a few. There we go. We can see Pete's joined. But I'll just wait a few moments. So the reason for doing a quiz, I ran a session recently, and I think there's some of the figures associated with interactions with health and care, the actual equivalent of carbon dioxide released is kind of fascinating and a bit scary. So I'll just start. I think people can join late, so I'll just give it a go. And you get points the quicker you respond. So in terms of the carbon dioxide equivalent of an average outpatient attendance in the UK, is it the same as a load of washing, laundry, which is 2 kilograms, the same as the cost of the production of a pair of jeans at 22 kilograms, or a week's worth of food shopping, and I've based it on a vegetarian diet of 44 kilograms. So as I say, I'll wait for people to put their response through and just see. And again, I wish there was a prize, but I think it will be interesting nonetheless, and a bit of a tee up for the quiz. I think it'll tell me when everyone has answered as well. Again, great job here of showing my technical prowess. So it was indeed 22 kilograms. So the average outpatient appointment, so again, including that patient travel, is 22 kilograms of carbon dioxide. As I say, the equivalent of producing from scratch a pair of jeans. So Vicky, this looks rigged, doesn't it, already? So Vicky is in the lead. Question number 2, what is the carbon dioxide equivalent of an average inpatient stay in the UK? So is it the same as 400 kilograms, which is the same as insulating the loft of a house? 600 kilograms, so again, a one-way transatlantic flight, or 6,500 kilometers by petrol car, which is that kind of ton of carbon dioxide. Oh, I like that comment as well, Kathy. The prize is the learning. I'll take that. That sounds very, very parental. So again, I think we're waiting for one last responder, and then I can put you out of your misery and talk to you about PKB. Interesting. So it's correct. So it's the same as a transatlantic flight, one way. So again, that's an average inpatient stay. Oh, so Charlie has jumped up the leaderboard with that one. And the final question, what is the average carbon dioxide equivalent of an emergency department attendance? So that includes the ambulance as well. So is it 50 kilograms? So an average UK household leaving all of their appliances on standby for a year. Is it 100 kilograms? So using a smartphone for roughly 10 hours a day for a year, including the kind of charging of that. Or is it 200 kilograms? So the cost of the production of a gold necklace. So again, I think we're waiting on one final response. So I was surprised at this one. I thought it was going to be higher as well, but it's 50 kilograms. So this is the grand reveal of the ultimate winner, which is Harriet Jones. So I'm going to struggle to keep that level of excitement going as I talk about Patients Know Best. But I just thought I'd kick it off as I found those stats interesting as we're looking at what we can do to increase the sustainability associated with the delivery of care. I think it's useful to know the measures and the metrics that we're playing with, and actually looking at some of the size and scale of the kind of higher emitting interactions and interventions that we have with patients. So just to give you a bit of background into who we are, what we do, and why we exist. So I'm Tom from Patients Know Best, a part-time quiz runner, obviously, but part of our business development team, but I'm also our lead for sustainability. So I've been fortunate enough to be part of the Propel Net Zero program and learned a huge amount as kind of being part and parcel of that program. So just to give you the background from a Patients Know Best perspective, so we at PKB exist to solve this problem. So we know that patients interact with a huge number of different services and settings. As their care becomes more complex and more specialist, the number of interactions that they have, predominantly face-to-face, increases. We know that information doesn't flow between those different interactions and those different services and settings as it should. We know there's technical barriers when it comes to interoperability, and we also know that there's legal challenges for information moving as it should. So should I or shouldn't I share this information based on the patient's wishes? We also know that the one commonality between all of those different interactions, the only person that attends everything is the patient. And when it comes to having any access to the information, they tend to be neglected and left out of that. So that is why PKB was developed. So we put the patient in the centre, receiving a copy of information from across their health and care economy for them to have access to, for them to contribute to, so whether that be through apps, devices, wearables, or tracking particular symptoms. We enable the patient to share this information with whomever else needs access, so whether that be parents, carers, family members, other care collaborators across the voluntary sector, or other health and care professionals. We also prompt the patient to access educational materials to support prevention rather than reactive responses and treatments. And we also provide patients with the digital tools they need to interact with services remotely, rather than there being that reliance on a face-to-face interaction. So this is just a bit of a snapshot of all of the different capabilities of the platform. So as I mentioned, that ability to interact with healthcare professionals via asynchronous messages, and we have examples of patients with complex epilepsy being able to share videos with primary care, local community services, local acute and tertiary specialists, whether it be responses to questionnaires, again, determining whether or not it's appropriate for that patient to come in, knowing that the immunotherapy toxicology services in Hull University Teaching Hospitals is using that capability extensively. or whether it be the patient actually taking that responsibility and tracking their own health through symptom tracking, through adding measurements themselves, or through integrated apps, devices and wearables. So as well as providing that single front door for patients, the next step for us was to integrate that directly from within the NHS app. So not only giving patients access to their own information, allowing them to share it and contribute to that record, being able to access educational materials and interact with their healthcare professionals digitally. We wanted to streamline that to ensure that a patient can actually access all of that kind of rich functionality directly from within the NHS app. So being able to utilise and register using NHS login, and then having a number of integrated jumping off points to support their interaction with their record and their healthcare professionals. So this capability has been switched on across the Humber Coast and Vale ICS, and there's pockets in West Yorkshire, in Wakefield and North Kirklees, where this capability is also enabled. Something I should have mentioned at the start, all of this rich information is centrally hosted in the UK, fully encrypted, and only the patient and those health and care professionals have any level of access to that information. We at PKB can't see or access any of that information. The final element I wanted to touch upon, just to give you that kind of background information before touching on a number of case studies, is just a recent piece of work that's kicked off with the UK Kidney Association. So we're in the process of replatforming and providing PKB for every renal department across the UK. So again, across the Yorkshire and Humber patch, we know that that has an impact for Hull University teaching hospitals, for York and Scarborough, for Leeds, for Bradford, as well as those in the South Yorkshire patch. So we'll be inviting the 75,000 patients who are currently on renal patient view to have access to PKB. And that's alongside the just over 1 million patients who've registered to use the PKB platform to date. So whilst I've provided that context and that kind of background around who we are, what we do, the kind of capabilities of the platform, I now wanted to touch upon the kind of so what. So why do we do this? What are the benefits that we've realised, both in terms of improving patient outcomes, increasing capacity within services, and all importantly, the knock-on impact that has upon the environment. So I wanted to touch on 3 case studies, so 2 within IBD and 1 within dermatology. So within IBD, we've been supporting Bedfordshire hospitals for a number of years now. And by simply providing patients with access to the tools they need to self-manage, so the prompts to record symptoms, the resources to access information to support self-management, and the ability to send a message as and when they need further assistance, the team in Bedfordshire hospitals are removing unnecessary face-to-face appointments. So for a patient cohort of 600 patients, they're freeing up 1,100 appointment slots per year. They're also, by freeing up that capacity, able to see patients who need to be seen in an emergency scenario sooner. So they can offer that intervention within a 48-hour period. Previously, it was weeks. So that has meant that they're avoiding 240 surgical cases, and they're also reducing their emergency admissions. So previously, 1 patient within that cohort would attend ED within a 5-week period. That's gone down to 0. So not only is that better for the patient, they're not having to go to those unnecessary appointments, they're in a position where they're empowered to take care of themselves and have the tools to actually appropriately self-manage and self-monitor. But they're also having that environmental impact. So reduced attendances at outpatients, reduced emergency admissions, reduced surgical procedures, all with an associated carbon cost, as we covered within that quiz at the start. Similarly, the team in Surrey and Sussex Healthcare, by providing patients with access to test results, the tools they need to self-manage and support, the tools they need to reach back into their healthcare provider, they're able to offer alternative treatment courses which are better for the patient with less severe side effects, and improved patient outcomes, but also cheaper in terms of the medication budget. And as I say, all importantly, providing that ability to reduce the carbon footprint associated with the delivery of care. So again, avoiding those low intensity bed days, those emergency admissions, and that travel. Similarly, within Bedfordshire hospitals, again, avoiding those surgical procedures. So all of these impacts, all of these things that are perfectly aligned in terms of we want patients to have that ability to access information, that ability to self-manage, reduce the interactions that they have with healthcare professionals when they're not needed, promote and push preventative treatment rather than reactive treatment. All of that is aligned with reducing that environmental footprint. The final case study I wanted to touch upon was part of our work in Swansea Bay within their dermatology services. And I've just noticed on my slide that I've spelt dermatology incorrectly. So again, quite a simple use of the platform, give patients access to their test results, allow them to interact with their healthcare professionals via messaging rather than attending a quarterly appointment, having that library of resources to access the information that they need to self-monitor and self-manage, and again reduce a huge amount of carbon by, as I say, removing those unnecessary face-to-face interactions. And just as a final, quite a pretty slide, I thought, this is all part and parcel of our social mission. So being a benefits corporation, trying to work towards patients being the experts of their own health. As the name suggests, patients know best, and that environmental impact in terms of is kind of core to us delivering upon that. And as has been said throughout this this session today, the two are so intrinsically linked. If the environment, if we're destroying the planet, we reduce the health equalities, the ability for patients to remain well. The two are just so intrinsically linked. So that was all I was going to cover today. Oh, sorry, no, that's a lie. Just to give you a bit of an idea, I've kind of gone for a bit of a broad focus. From a Yorkshire and Humber perspective, we're working closely with the teams in Hull University Teaching Hospitals. We're working with the teams in York and Scarborough, Northern Lincolnshire and Goole, Mid Yorkshire, and as I mentioned, all of those renal services across the patch. Are there any queries or questions? I know I've covered that quite faster than I was anticipating. Oh, Frank, I think you've got your hand up.
Yeah, thanks, Tom. Thanks for that overview. Really fascinating. And I think, so I suppose my question is, the information you've given us would lead me to believe that you're quite a well-established IT company in working with the NHS already in the UK. Could you speak a little bit about the specific benefits of being in the Propel Net Zero program?
Yeah, of course. So I think so as a company, we'd been looking to deliver upon that challenge that I mentioned at the start for a number of years. So as a company, we started in 2008. And I think we only really started to think about our environmental impact maybe 18 months ago to 2 years ago. And I feel like we were lucky enough to have engagement with the Yorkshire and Humber AHSN, again, probably 18 months ago. So actually, as we were looking at what can we do to support services in reducing their carbon footprint, what can we do in terms of actually analysing our own carbon footprint. So as a company, if we're delivering these savings, but at the same time not being environmentally friendly ourselves, obviously that's no good for anyone. And then the third stage is actually, if there is a gap in terms of the benefits that we're delivering, how can we look to offset them? So I think as part of the wide Propel program, it's been really useful to have those ongoing conversations with experts in this area to work as a bit of a sounding board. So and I was going to say it sounds daft, but actually having that ability to talk to someone who is independent of the company that you're working for to say, actually, we're stuck here or we're struggling here, or these are the things that we want to be able to do. In terms of and I should have said this as well, and I apologise to Pete and Vicky, because they've had a right fun time, I guess, of helping us quantify some of these savings, but that we couldn't have got to a position where we're actually able to quantify the carbon footprint per patient, per per the use of PKB across those 3 case studies. And there's another case study that, again, we were supported in looking at. So yeah, in short, I think we couldn't have quantified the savings that we're making. We couldn't have hatched a plan in terms of looking at our own environmental footprint and working through that and having that sounding board to make sure we hadn't missed anything. And then in terms of us, in terms of our journey to look at that offsetting, again, it's been incredible having that ability to kind of bounce ideas back and forth and to learn. And the other thing that we're not very good at doing is communicating the benefits that we're delivering in our plan. So again, having Pete and Vicky as the nudge to say, you're doing all this stuff, but you're not doing a very good job of shouting about it or talking about it.
Thanks. I might just come in on the back of that, and I think I probably wasn't fully listening because I put a question in the chat about the carbon offsetting, but this is where some of the conversations we've had. What I like about your organisation is you kind of not just looking at one aspect to this, and you're pushing boundaries. And I've just said to a couple of people, I think other digital SMEs can learn a lot from you. And again, what we do as an HSN is we try and get companies to collaborate with each other for the good of the patient. And I think we know that PKB do a lot of that anyway. There's lots of digital products that you're integrated with and work with. So that's great from a patient perspective, but I also think they can get some of the learning from your journey. And I am keen on things like the offsetting. I think certainly if you can offset your organisational footprint in things that benefit the region, the area that you might be working on patients, I think there's a real double win there. So I'm just looking forward to following your work, really. I'm glad we've been able to help. Like you said, we do want people to shout about it and talk about it because the penny hasn't dropped. As I put that comment earlier on, I was speaking to an organisation yesterday, and it's like an afterthought, the benefit that this can bring, this digital innovation, which I get that, they're just focusing on the clinical care at the moment, but we've got to keep chipping away that, make sure you think and capture this environmental benefit. So well done, and yeah, hopefully others can follow some of the work you've done.
So we have a question from Jennifer around what support do you need to roll this out nationally?
Sorry, my Teams decided it wouldn't allow me to unmute. So I think in terms of national support, so we're having conversations with the Greener NHS team in terms of the kind of environmental lens. I think in terms of this being rolled out nationally, I know there's a number of funds that are available to support this type of innovation. So actually that ability for patients to have access to a patient hold record. So I think it's willing services who are looking to transform the way they're delivering care, which I know sounds like a small ask, obviously, but I think that would be it really. Jennifer is looking at those services that are interested in doing things differently, those organisations and ICSs who are looking at doing things differently, and then building that kind of irrefutable body of evidence to say we can't afford not to do this on a national basis. So again, just in terms of some of the work that we're doing, we're already working on an ICS-wide level with areas like Sussex, with North West London, with Nottinghamshire. So we're kind of building those pockets of influence. And as we've seen, there's actually that national work around the UK Kidney Association making that plunge. We recently signed a contract with a young epilepsy charity to do the same for epilepsy. Oh, sorry, I've seen you've popped up, so I can let you ask your question in person.
I thought it was better if you could see me, but my Teams wasn't playing either. I also wondered about whether you had any plans to take it internationally once it's a bit more established in the UK.
So yeah, so funnily enough, we're already part of a national program in the Netherlands. So they have a similar focus. It's called the PGO program, and there's a national body called MedMy who are similar to NHS Digital, and they've acknowledged 9 PGO providers which patients can use to access their own information, and PKB are one of them. And I think there's also other areas of interest, so places like the Republic of Ireland and Germany. I think it will be. I think there will be that international expansion, but still 95% of what we do is NHS focused. Well, I agree with Pete's last comment as well around CVD and cancer networks.
Yeah, I wouldn't disagree with that either. If there aren't any more questions for Tom, and I'm always take silence as agreeing to whatever it was that I just said, a tactic that has worked incredibly well in my marriage, then move on to Ava. Thank you, Tom. That was really, really interesting.
Thank you, Kathy. Shall I share my slides from my end, or would you prefer to run them from your end?
Whichever you'd prefer to do. Vicky and Rox are lined up to put them on the screen if you find it easier. I know that Teams can sometimes be quite temperamental.
Let me see if I can manage to run it from my end. Just forgive me for the delay. This is one of those Teams things, you know, when you desperately try to find a command bar and Absolutely. It refuses to show its face.
Yes, I am pretty sure that Teams waits until it's absolutely critical, like some kind of artificial intelligence, and it knows when it needs to go wrong.
I think it is actually going wrong because it's not highlighting my presentation. Well, let me see. Slideshow.
Vicky, would you be able to put up the slides, please? Here we go.
Fantastic. Thank you so much. I'm sorry, I have to do the sort of next slide, please, routine here. Really delightful to see the PKB presentation and highlighting of the importance of data being accessible to patients as a tool to empower self-management and optimized care across different organizations. Our company focuses on a slightly different angle, and we have built an integrated care platform which focuses on connecting professionals from different levels of care and different settings of care to an individual, so that care is built around the needs of an individual, where they're seen holistically and they're at the center of what is being delivered to them, and they're an active player in the processes rather than squeezing people into well-defined disease pathways. We describe ourselves as a blend of methodology and technology, and we always put methodology first because the technology is really easy to cobble together in 2021. There's been a mushrooming of companies in the wide rubric of remote patient monitoring, which encompasses a lot of different flavors. Could I have the next slide, please, Vicky? Our highlights, we started in Norway in 2010. We were inspired by a personal experience of a family member of one of our founders. We were then also watched a whole system demonstrator in Britain, in Newham, which delivered fantastic results for the patients in the system and didn't quite go anywhere in the UK. But our founders took it to Norway. In 2013, we had the first patient on the solution. We have 200 plus contracts across Norway, China, UK, and now also US. We had over 40,000 patients serviced through our Dignio Connected Care. We cover 90% of the Norwegian territory, so in some form or fashion. So we did the opposite journey. We're an international company, foreign direct investment, that came to settle in Britain and see if we can help NHS much as we've been helping the Norwegian healthcare system, which is a publicly funded healthcare system as well. We've achieved that figure needs to be updated. Last we saw from one of our flagship customers in Stockport, Mastercall Healthcare, social enterprise, 55% hospital admissions avoidance. And one of our heart failure projects indicates even higher figures, but the official report has not been released yet. And for us, the biggest gain is people feeling that they are more in control of their own health. So they don't feel controlled by the disease, they're able to plan their activities. Could I have the next slide, please? And the remote patient monitoring for the risk of teaching grandma how to suck eggs, we bundle a lot of things under that rubric. So there are the one data capture tools, which sort of feed data from different things, devices, patient-reported outcomes, symptom reporting, whichever existing records, to somewhere else, and that sits there and gets reviewed by various teams. Then we have disease-specific tools which focus on single disease pathways. There's a plethora of specialist tools that will only look after diabetes, will only look after cardiovascular, will only look after something else. Then we have generic non-flexible tools which have a very modular build where things get added on as requested by the customer. The problem there is that as you add and take away, it's a bit like a Jenga tower. It can collapse at some point. And you end up with a law of unintended consequences where you don't know how things end up interacting. Then we have general flexible tools, something like Digno. We were built from the very outset to be able to evolve with the individual and to be able to evolve with the care team looking after them. So as the multidisciplinary team composition changes, as they interact with different levels of care, that can be all adjusted. And there's no revolutions in terms of the tools that the patient needs to interact with or the citizen needs to interact with to stay well. Next slide, please. And existing approach to people with multiple long-term conditions is that they end up with multiple apps, multiple tools, which are complex for them to use. There's fragmentation of where the data goes. Obviously, with PKB solution, there is hope that all the data will be visible as and when needed by all the parties involved. However, the reality today is that it's very often sitting in silos, and it's not accessible to the frontline practitioners who need to see it at the fingertips when they are interacting with the patient, sometimes in the field. And the other problem is that the teams do not talk to each other necessarily, and social care teams, for example, will not see what the healthcare records is and vice versa. Next slide, please. So we focused on building something which we refer to as integrated care platform, which focuses on enabling the connectivity between the care levels and interaction with the patient and with the citizen. And because of the nature of our solution, it's set up to be flexible and generic. So it can be used for telemedicine, it can be used for remote patient monitoring. We have Bluetooth integrated devices, 20 plus and growing. It can be used for medication adherence. That is one of the things that so much medicine is wasted. And very often it's wasted because of side effects, very often it's wasted because people don't remember how to take it properly. There are multiple journeys by social care support providers to do medication adherence visit and nothing much else. All that can be supported remotely through connected care solutions. We have reporting capability and self-management plan, and we are built to be interoperable and scalable. We're a cloud-based solution, much like PKB. Our data stays in Britain. AWS hosted solution in London. And we focused on building a solution that will follow the citizens through the full care journey, because for us, it's about supporting people from the first diagnosis, from the first time something goes wrong, and providing them with proactive care. So it's not about waiting for something to go horribly wrong and then treating it. Prevention is always cheaper than the cure. So it's about helping people to stay well, get well, stay well, and remain stable and capable of doing what they want to do. We have won multiple awards recently in Britain, including for collaboration with the NHS, our flagship customer, Mastercall Healthcare, social enterprise in Stockport, projects funded by local authority, which we felt that was so well ahead of the ICS ideas. And that's what happens when a local authority wants to provide a really good service to its citizens and have very progressive and visionary outlook, and recognize that a lot of the ills in terms of health inequalities, impaired opportunities for the local population are the result of lack of support to stay well, and looking for tools that enable that sort of. Sorry, I'm sitting in a booth, and clearly I overused my webcam, so the light went off. Apologies for that. I didn't disappear. So they looked more progressively. Could I have the next slide, please? And in terms of impact on care delivery and experience, and that's where the NHS Net Zero comes into it, patients have an improved sense of security. The early detection of deterioration means that they know someone will pick up when they're not well. They can improve their self-management by access to trusted sources of resource and personalized care. It's all about building care that works for the individual. And because it's built in collaboration with them, they're more likely to adhere. Our satisfaction, this is just from the patients in the UK, 99%. And people, once they're on the system, they don't want to be taken off. We have deployed in some cases where they are put on the solution for a limited period of time until they get better. And at the point where the clinicians want to take them off the solution, they go, no, I want to stay on this because it makes me feel safe. So to us, this kind of patient attitudes and testimonials are the sort of, the greatest verification that what we have created is a tool that actually works and helps people. For the clinicians, we're looking at efficiency gains. The tools within our platform enable optimizing how workflow is delivered. Access to information when needed across multidisciplinary teams, including community teams out in the field, at the fingertips, with all the information at the fingertips. We transform communication between the teams and between the patient and those who care for them. And we enable the multidisciplinary team working, where people can see What was the previous interaction? It's all recorded and audit trailed within the solution. And we have 100% satisfaction from the clinicians. When we ask them, would you recommend this tool to a colleague? They say, yes, I would. Because even though initially we faced digital fatigue, and the challenge with digital tools is that people had a lot of bad experiences already. COVID brought a lot more because of the urgency of deployment. And they've seen all sorts of things happen, some of which resulted in more work, some of which resulted in greater dissatisfaction amongst the patients, unreasonable expectations, and it really did not quite work out. So there is the reality is there's a digital fatigue amongst the frontline staff and commissioners. With Mastercard Healthcare, 55% hospital admission avoidance. They run 9 virtual wards with our technology. Same solution, exactly the same, 9 virtual wards, including mental health, pediatric, and the high-intensity users that Kathy was talking about, they run a virtual ward for them as well. With those particular patients who would by default dial 999 for an ambulance, very often because they feel lonely, need a bit of chat, there are other challenges which should be handled elsewhere in the system, but they're not, so the default is dial an ambulance. And because of the legal obligations, obviously that gets handled, etc., with the resulting care miles incurred. And the unavailability of that ambulance to go to someone else was they're busy dealing with this call. So that one has resulted in major savings to the local health system. Our heart failure cohort of patients at Suffolk Royal, that's where we have a number of patients who didn't want to be taken off the system. And also the initial analysis indicate massive savings and major reduction in hospital admissions. And originally we come from Norway. Our very first independent evaluation was from City of Oslo, project commissioned by the equivalent of our DHSC. And that was our first inkling that our solution really impacts on patients and care delivery systems and colleagues delivering that care in different settings, primary care, social care, really positively. Keeps people at home rather than being admitted to hospitals or residential care, allows the care providers to deliver the care remotely and only attend to those who need their attention. So within the solution, you have a risk stratification assumption, which allows you to see those who need your attention the most and sort of keep everyone who's stable in the background, but safely. Could I have the next slide, please? This is an infographic which is a bit outdated. This is 44% hospital admissions from our colleagues at Mastercard Healthcare. That's their own evaluation, nothing to do with us. We like independent evaluations because they verify that what we say is what happens in reality rather than us commissioning it. Could I have the next slide, please? These are just some of the examples of different users and the benefits of our solution for them. And if we move on to the next slide, I don't want to dwell too much on that one. So this is just a real life example of a patient who's benefited by being able to utilize some of the tools within our platform. We have a multitude of tools which allows us to support all the variety of different clinical pathways. And people pick and choose what works for the specific pathway, what works for the organization, what works for the patient, or the citizen that they're trying to prevent from falling ill or getting worse. Could I have the next slide, please? In terms of why would you trust us with your data? We have over 10 years of methodology development. We focus on continuous feedback loop in co-design. So when we deploy, we don't just give you a shiny box and walk away or be on a phone or video call and guide you through things. We stay very closely with our customers because we want to learn. So our solution keeps on evolving with every single deployment, either here or elsewhere. We get feedback. We learn about new scenarios of deploying technology and how technology can support digital transformation. So for us, it's all about working with where we are, the reality of the place and the ambitions of where they want to go from here and how we can underpin that progress and support them to achieve their ambitions. And we also support change management, and our approach is very collaborative deployment. The technology is flexible, dynamic, it's cloud-based, nothing to install, nothing to disconnect. In terms of impact of our supply chain, we are Apple first product, and they focus very much on the green impact of the supply chain. And what we've done when Pete was talking about collaboration, we are collaborating with Automedi to quantify the impact of our solution dynamically, because there is a lot of moving elements in terms of what we do, what we use, the type of devices we utilize, but also the type of pathways that we replace or support, and looking at all the elements interacting dynamically and changing each other. So we're very interested in having a more broad estimate of our impact, which allows us to look more in terms of a complex system impact. Our solution is feature-rich yet intuitive. People tend to stay, our customers tend to stay with us, and we know it's affordable in terms of cost effectiveness, being created for a publicly funded healthcare system to begin with. We passed DTAC, which is the latest verification of safety of digital solutions in the UK, created and promoted by NHSX. We published our DSPT. We passed ORCA assessment, which again verifies whether an app actually does what it says it does. We adhere to a lot of standards which verify the quality of our solution, but also how we handle data and how we update our software. And we use 5.7 standard for data transfer. I may have to move here a little bit. Sorry, I've just gone into the darkness again. Apologies for that. I think my next slide is just a closure, which is our logo. And in terms of our green impact, the care miles saved is an immediate gain. So that is something that goes without saying. But it's not just about care miles saved in terms of avoiding face-to-face appointments and hospital admissions. It's about being able to rework the hospital estate around the connected care delivery, where you don't have to have large clinic rooms, where you don't have to have large car parks, where you don't have to have family friends visiting, because you can safely support people remotely. But it's all about, our solution is all about connecting those who deliver care to those who receive that care and providing them with a suite of tools that support it in one package. So you train your staff once, you train your patients once, you train your multidisciplinary teams, social care colleagues once, and that's it. And then you just build your care up around the individual in a holistic way. Everyone has the same view. Everyone sees the conversations that went on, communications that happened, and you can optimize your pathways and you can really perform proper digital transformation where patients feel safe, the families know they're looked after, and professionals feel empowered. So one piece of feedback from residential care settings, the carers, the usual feedback is they won't know how to use digital tools. They're not medical professionals. The morale shot through the roof. They felt they were part of an important process. And with the current challenges within the social care domain and ambitions of integrating care across different levels of care in different settings, we're bringing a tool that enables it. And because we deliver care remotely, the impact is immediate. But I won't dwell onto details in terms of wider impact. Care miles saved, PPE used far less, patients empowered, staying well, keeping things local. And that's what makes a difference. And we're working with Automedi to evolve a good model for quantifying our impact, and we'll share that in due course. Thank you.
Thank you. That was fascinating. Out of interest, are you able to tell us which innovation it was in Newham that you saw that was inspiration?
I can send you a link to the, we have the sort of the original article that was based, I can't remember the exact name of the project. It was rolled out under David Cameron. I think it ran for 3 years. I will find the link to the original article that we had about it.
It makes a good story. Thank you. So Carl has asked whether it's possible to have a chat around various things, and Vicky has suggested that if you could put your email address in the chat, that would be really helpful for people to contact you, provided you're happy for that to happen.
Oh, absolutely. Very happy to talk, because we do have, we're very keen to share the learnings, you know, and the thing that we've really struggled and where the AHSN and the Propel Net Zero has really helped us was being visible to a lot more people, because, you know, the lessons we've learned with Mastercall Healthcare, the sort of digital hub model they've set up and the way they optimize the kind of staff that can deliver safe but effective care is something that should be replicated elsewhere, because, you know, we all struggle with availability of highly qualified colleagues. And if we can optimize care delivery and who delivers that care, but in a safe, good quality way, why would you not want to do it? And the other problem is the social care staff and staffing and all the challenges, medication adherence, all these things, you know, we want to share the best practice, want to share the lessons learned to demystify digital transformation. That doesn't have to be painful. It doesn't have to be expensive. It doesn't have to be a revolution, but also the sustainability angle. I have an asthmatic child, and for me, the story always is, why do I see lorries from the NHS supply chain going past on the main road, rambling down? And then my child starts having breathing difficulties. You know, the two are not disconnected. So it's almost like a catch-22. And my feeling is problems need ownerships. And now with the Propel and the sort of YH AHSN taking the ownership of the green conversation, it just focuses if an SME wants to know about what do I do with quantifying my impact, what do I do about greening my processes, at least they have someone to go to ask, how do I do this? Do you have some tools? You know, so I think it's really important that someone takes the first step, and we all just keep talking about it, because the more we talk about it, the more it gets normalized and becomes a done deal. I was really relieved to see on one of the guidelines, it had, and when commissioning, consider sustainability. I thought, yes, it's now in black and white in writing, consider sustainability. And they didn't mean just financial, they did mean the environmental sustainability. Good.
Excellent. I've got Frank with a question, and then Carl.
Thanks, Ewa. I think you've answered my first question, which was what specifically has Propel at Net Zero added. But so my question then would be, if you were talking to another organisation that was considering applying to Propel Net Zero, and or if you had your time again, is there anything that you would do differently?
I think would start the actual calculations earlier, but also what we're doing going forward. In every single project since we've joined, we put in a costing for the green impact calculation, and we are serious about it. So we sort of view it much as we put costings for not necessarily visible to customers, but within our internal calculations, we put costings for economic evaluation, because we want to have, you know, sort of proper independent economic evaluation, which needs to be funded by something and commissioned from someone, usually academic institution. At the same time, we're putting a cost for the green impact evaluation, because we feel it's important and should be treated equally on equal measure with the economic evaluation. So that's what we're doing differently. So by default, in every funding application, in every client deployment, we add an element of, we will be calculating the carbon footprint impact of this project.
That's brilliant. Thank you.
Thank you. Carl?
Hi, yes. Listen, thank you very much for the presentation. Very good. I saw that you're actually working with EMIS. Are you working with Professor Shugford, Edenbridge Apex at all?
We don't. So what we did with EMIS, we completed a partner API, so we can send data directly into EMIS. Okay, and you also mentioned, I'm working on a couple of projects, some trusts in England, and also the Cobell programme, which is a collective of care packages, care programmes, multidisciplinary in one location. Are you working with anybody? I'm working with on the digital front, by the way. Are you working with anybody on the estate side to start linking patient pathways, monitoring patient flows, measuring frequency, the types, etc., at all? Not yet. So the most we've advanced, we've actually managed to, we are in a setting up stages of a project that will combine different levels of care. So our conversation in the UK so far has been because of the disconnect between different levels of care and sort of, you know, almost things that feed into how care is delivered, like estates, and where care is delivered and by whom. It's been very disconnected. So our struggle until the conversation about the integrated care systems and bigger focus on connectedness has been very, very, very fragmented. So yes, we'll use your solution for this pathway, and we'll use your solution for this. So our deployments, apart from Mastercall, who have sort of connected all the dots, everywhere else where we've deployed has been one use case. And it's not spreading. And you're quite right. This is the way we should be thinking about deployments, about connecting the benefits at different levels of the ecosystem.
So would you be interested in meeting some of the ecosystem people that we're dealing with currently, looking at supply chains and obviously smart buildings, both
absolutely,
primary
absolutely,
care settings?
and yeah, absolutely, and the sort of hospital of the future, and focus on optimizing how estates are planned, built, maintained, and utilized, and how that can be that needs to be underpinned by a different model of care delivery. Absolutely.
Brilliant. I'll drop you an email. Thank you.
Thank you.
Thank you. Any more questions or comments for Ewa? No. Any questions for Frank, for me, for Vicky, for Pete? Excellent. Okay, I'll hand you back over to Frank then for the rest of the agenda.
Well, thank you very much, Kathy. I don't think there's very much of the agenda left. It excuse me. It just falls to me to thank everybody for coming this afternoon, and specifically to thank Ewa and Tom for their time and their enthusiasm. It's been fascinating to hear their stories, hear about their software solutions or their businesses, and it really gives me significant hope for the future. It's really brilliant when you hear somebody talk and they're saying the things that you want to hear them say, and you guys absolutely are. So I think thank you very much to you both. Thanks to everybody at the AHSN for their continued enthusiasm and work on this. And I will draw it to a close now. I'm not going to take up any more of your time. You can have 7 minutes back. Thank you very much and have a good evening.
Thank you, Frank. Hope you feel better soon, and thank you, everybody. This has been fantastic, and particular thanks to Vicky and Pete for all their efforts in this.
Thank you very much. Bye-bye.
Bye.
Thank you. Bye.